Seniors who are lonely have higher blood pressure and higher risk of dementia, cardiovascular disease, and stroke. So why is loneliness so bad for your health? And what can we do to help combat it? Let's take a look at some of the ways that loneliness affects our health. I'm a geriatrician, and I make weekly videos on topics related to aging. If you're new here, please consider subscribing. Loneliness is a complex issue that can be defined as a feeling of disconnection or lack of belonging. It occurs when an individual perceives the quality of their interpersonal relationships as being less than what they need. There are different types of loneliness. One type is when people don't have enough relationships or social contacts. Another type is when people feel that their relationships are not satisfying their emotional needs. But how common is loneliness in seniors? In older adults, the rate of loneliness can range anywhere from 15% to 38%. And the numbers are even higher if you're re-looking. It's just at those over the age of 85. This population has a loneliness rate of up to 47%. You might say, hey doc, I thought that older adults would want to be more socially connected earlier in life. But now that I'm older, I've actually had most of my friends pass away, and many of my family members live far away, so it's not surprising that I'm lonely. Well, there's two parts to this. One is the loss of friends due to death, and another part is living far away from family. If you fall into these categories, you may want to watch my videos on maintaining long-distance relationships with adult children, and also one on coping with the grief of losing a friend. But let's get back to the question, which is why is loneliness such a big deal? We all have the innate need to belong to a group, to have that sense of community. It's something that starts early on in our lives and continues throughout. Back in the days when humans lived in tribes, you were more likely to survive if you had a group of people who could help you. Being alone meant that you didn't have anyone to protect you or help you gather food. Nowadays, we don't have to worry about being hunted by wild animals or anything like that, but this innate need for connection remains. When we don't have that social connection, it can take a toll on our mental and physical health. One way that loneliness harms our health is through the stress response system. Our body has a stress response system that prepares us for fight or flight when we perceive a threat. When someone yells at you, you startle and jump. That's the fight or flight response. Or, if you see a tornado coming, you run and hide. That's also the stress response system. Your sympathetic nervous system gets activated and releases a bunch of hormones like adrenaline and cortisol. Now, if you're lonely, your brain interprets the lack of connection as a threat, which then activates the stress response system. So the hormones are released unnecessarily. Having chronically elevated levels of these hormones causes wear and tear on your body and increases your risk of having a poor immune system. High blood pressure, heart disease, and diabetes. Some studies show that loneliness also causes an increase in inflammation. Inflammation is the body's natural response to injury and infection, but chronic inflammation raises the risk of multiple diseases, including depression, dementia, and cancer. Another way that loneliness affects our health is by affecting sleep. Poor sleep increases the risk of cognitive impairment, stroke, and cardiovascular disease. The kind of loneliness that comes from not having enough social contacts or not enough satisfaction in one's relationships has been associated with insomnia. People who are lonely often have difficulty falling asleep because they're ruminating on negative thoughts and emotions. They're thinking, why am I alone? No one calls me. I don't have any friends. Also, people who are lonely have a disrupted circadian rhythm, which makes them have a hard time getting up in the morning, and they tend to go to bed later in the evening. These disruptions in circadian rhythm are associated with increased risk of dementia, cardiovascular disease, diabetes, obesity, and breast cancer. Loneliness also affects our cognitive function. The University of California, San Francisco did a study called the Nun Study. They studied a group of Catholic nuns who lived together in a community. They took measurements on the nuns' cognitive function every 2 years, and they also looked at the quality of the relationships that the nuns had with each other. The study showed that the nuns who reported having more meaningful relationships performed better on cognitive tests, and also had less decline in their cognitive abilities. Those nuns who were lonely had faster cognitive decline and developed dementia faster. This study shows that loneliness accelerates cognitive aging and increases the risk of dementia. And finally, the last way that I'm going to talk about today that loneliness affects our health is by increasing the risk of falls. I've talked about falls before and how they are one of the leading causes of emergency department visits, hospitalizations, and deaths in older adults.
Oh.
Several studies show that loneliness increases the risk of falling. One reason that lonely people are more likely to fall is that they do and get out of the house much because they do intend have anyone to visit or no one is visiting them. So they're not getting the exercise that they need to maintain good balance control. Also, people who are lonely have higher rates of depression, and depression increases the risk of falls. Another theory is that people who are lonely have decreased response time, which increases the risk of falling. And lastly, people who are lonely tend to have higher blood pressure, which increases the risk of having a stroke. And stroke is a common cause of falls. So what can we do to address loneliness? If you're concerned about loneliness, first figure out whether it's because you do and have enough friends or family nearby, or whether it's because you do and feel that your relationships are satisfying your emotional needs. Then work on addressing that issue. If it's because you don't have enough friends, you can join a club or a group that meets regularly or volunteer. You can also use technology to stay connected with friends and family. However, keep in mind that while technology is good, nothing replaces face-to-face interactions. If it's because your relationships aren't satisfying your emotional needs, then work on improving those relationships. Set up regular times to call your family or friends, and if possible, plan visits with them. I have a video on maintaining long-distance relationships with adult children. Make sure to check that out. There's a lot of things that you can do to improve your relationships with family and friends, and I review them in that video. Another thing you can do is seek professional help. A therapist can help you explore issues related to loneliness, develop coping mechanisms, and help you build social support. Now, if you're a family member or friend of an older person, here are some ways that you can help combat loneliness. First, spend time with them. Visit them in person or give them a call regularly. And if you live far away, use technology to your advantage. Video chat with them. Ask them what's going on in their life and listen to them. Sometimes just knowing that you care can make a big difference. Also, encourage them to stay active and engaged. Help them find activities or groups that meet regularly. Encourage them to volunteer or do things that they enjoy. Finally, help them seek professional help if needed. Loneliness is a serious issue that can affect a person's physical and mental health. But there are things that we can do to help combat loneliness. By working together, we can help ensure that our loved ones have the social connections they need to thrive. If you found this video helpful, please like and share it. Hope you have a wonderful day, and I'll see you next time.